Tammy Murphy, right there. Commissioner Doctor. You good?
There you go. As long as I'm number one with the folks on the other side.
I'm good on the other side.
How's everybody's brackets doing? Oh, we're not talking about that. Okay, sorry.
We're here to talk about Murray State.
That's it. How about those guys, huh? Good morning, everyone. I am privileged to be Barry Ostrowski, the CEO of RWJ Barnabas Health, a healthcare system that was launched here some 23 years ago. And I am delighted that we are able to host this very important announcement and to acknowledge and welcome not only you, patient care comes first, but acknowledge our honored guests, of course, led by our governor. And I need to be able to share with you how delighted we are for the enlightened, visionary leadership that our governor has given to our state in such a short period of time, and in particular in our industry. You know that we have vulnerable communities that need health care. We need to make sure that people have access to health care. And the First Lady and our governor have made that a priority of this administration. And our working with them and all of you, the commissioners in this room, the elected officials, I am certain that New Jersey will continue to be a leader in health care. This morning I attended a meeting where we announced when it comes to quality in the United States, we have more hospitals in this state that grade out at A than any other state in the union. So that is a reflection of the leadership of our elected officials and policymakers, and we hope to continue that wonderful route to great health care for everyone. And so we're delighted, Governor, to have you here to make this special announcement, and let us pledge to you our support to ensure that everything that you envision for this state will become a reality. Thank you so much. Ladies and gentlemen, the Governor of the state of New Jersey, Phil Murphy.
Thank you, Barry. Thank you, man.
Thank you so much. Good morning, everybody. And thank you for joining us here at St. Barnabas Medical Center. Thank you, Barry. We've known each other, our family and you, a long time. So thank you for welcoming us and for your leadership in our healthcare community. As Barry noted, an unhappy constituent over here, excuse me.
One of Cody's.
Al, it's your town. One of Cody's. Barry and I both noted that this was not the first time we've been together this week. And we talked on Monday about the enormous opportunity. Micheline was with us. The enormous opportunity in Newark, which is exploding in the very best sense, and thrilled to be bookending the week with this announcement here in your house. So thank you so much. RWJ Barnabas is New Jersey's most comprehensive healthcare system. It's a system that hundreds of thousands of New Jerseyans rely upon, including Aaron Friedman, for everything from a checkup to emergency care. Everyone who is part of RWJ Barnabas is ensuring that our residents are healthy, both inside and outside your hospitals. And Barry, through you, I thank them all. Thank you. Ensuring access to high-quality health care is one of our greatest societal responsibilities. But we also have a responsibility to ensure access to affordable health care coverage. And these twin missions meet today. Before I go on, Barry alluded to this. We've been rated not just in the number of A-graded hospitals, but the safest hospital system in America. Save the Children ranks us as the #1 state in America to raise a child, with a lot of contributing elements and factors, including, importantly, health care. We wear all of the above as a badge of honor. It doesn't come cheap, and part of the reason we're here today is to make it more accessible and more affordable. But we always want to be that state that wears that not only as a badge of honor, but the state where it says, you know what, you get what you pay for in New Jersey. I'm all honored to be joined not just by Barry and his team today, but to be joined by some of the leading voices in the legislature for ensuring that New Jersey sets a higher standard in our nation's health care discussion and protects the principles of the Affordable Care Act. one of my heroes and role models, the senator from the 27th District, Governor Dick Cody is with us. Thank you, Governor. His partner in the rockin' 27th, a guy in the General Assembly. I don't know where we would be without his leadership and friendship and support. Assemblyman John McKeon. God bless you. And all the way up from the 7th District, and I know, what's that? The Fightin' 7th. It wasn't around the corner for you, but it's a lot. It means a lot that we have with us Assemblyman and a leader in healthcare in his own right, Dr. Herb Conaway. Herb, right. Again, I mentioned Al Anthony. I want to give Livingston a shout out here. This is one of the great communities, and Al, you're its boss, so God bless you. I also want to recognize our administration's partners in protecting the health of our residents. With us today, and you'll hear from her in a few minutes, the Commissioner of the Department of Banking and Insurance, Marlene Carita, is with us. Marlene, an honor to have you. And Marlene sits at the center of a lot of what we're doing in our state right now, generally and specifically to what we're talking about today. Marlene, thanks for your leadership. And a former legislator in her own right. Also in the front row in seats 1A and 1B, it's important to also note that our health commissioner is with us. Dr. Sharif El-Nahal is in the house. Sharif, thank you for your leadership. And Human Services Commissioner, right beside Sharif, Carol Johnson is with us and does extraordinary work as well. Carol, thank you. We also have representatives today because this getting health care right takes a village, and you need not only what you do in New Jersey and local communities, but you also need to be well-oiled and coordinated with the federal government. We have representatives today from both Senator Booker's office as well as Congressman Tom Malinowski and Congresswoman Mikey Sherrill. I also want to acknowledge in seat 1E, my wife, our First Lady, Tammy Snyder Murphy's in the house. So, Tammy. And a particular treat, by the way, Tammy and Barry used to serve on a healthcare board together, and Tammy has made maternal health a centerpiece of her agenda. Great to have you with us. You look very familiar. Tomorrow is the 9th anniversary, hard to believe, of the passage of the Affordable Care Act. It has benefited literally millions of New Jerseyans. The steps we took together last year to safeguard the Affordable Care Act in New Jersey have had real and concrete results. Look no further than to the nearly 10% reduction in premiums for individual health care plans that we achieved. That's a big deal. I don't think any other state in the nation can say that. Today, we are proud to announce the next phase of state-level reforms and protections that will build upon the progress we made last year. And we are guided by the core belief that affordable health care is not a privilege, but it is a basic right. First, fishing for applause. First, I am filing with the federal government an exchange declaration of intent letter, the first step in establishing a state-level health care exchange. This will have the benefit of protecting our affordability gains by making our marketplace more accessible, more accountable, and more responsive to consumers. It will take roughly a year for us to get our exchange through regulatory hurdles and up and running. And we will work alongside our legislative partners to enact the necessary statutory reforms to enable this. If we start now, we think we can finish this job in time for the 2021 coverage year, which means plans that can be purchased during the fall 2020 enrollment period. Our ACA exchange is currently run as a partnership with the federal government. So while we retain some responsibilities as a state, we do not have much control over things like enrollment periods, benefit designs, or other aspects of our marketplace. A true New Jersey exchange will be a strong measure of independence at a time when the federal administration continues to undermine and weaken the federal marketplace in their misguided efforts to dismantle and weaken the Affordable Care Act. I would just say, if we had a benign to positive federal administration that was doing what the Obama administration was to take something as imperfect as the Affordable Care Act, but step by step make it stronger, I'm not sure we'd be doing this today. But we have, among other things, no other choice given the current federal administration. And we think, by the way, we put destiny in our own hands. And that's always, in life, I think, a good thing. Having our own exchange will allow us to better tailor and regulate our marketplace to the unique needs of New Jerseyans by taking over all aspects, from the website to support for individuals and small businesses purchasing plans, to open enrollment period dates, which, as you know, under the Trump administration have been shrunk dramatically, and the amount of money supporting those enrollment periods has shrunk dramatically, as well as plan designs. In addition, we also must ensure that the principles which have underpinned all of our efforts to date are not undone by a future Congress or a future state administration, for that matter, which might be hostile to our efforts to safeguard affordable care. This work must continue as Attorney General Gurbir Grewal, along with his colleagues across the country, defend the ACA against Texas's efforts to scrap the law and with it protections that every American should enjoy. And that's no small mouthful I've just uttered. There is an enormous battle on the legal front to protect and preserve the Affordable Care Act. I'm also proud to announce that alongside of our legislative partners, we are working to develop a package of bills to write into state law the basic protections for healthcare consumers that are an essential part of the ACA, including things like protections for no-cost preventative care, prohibiting exclusions for pre-existing conditions, allowing children to stay on their parents' plans to age 26. Our kids are 21, 19, 17, 15. That seemed like a good idea at the time. Just kidding. And protecting mental health, substance abuse, and maternity care as essential health care benefits, among other steps. We cannot leave to chance the gains we've made in ensuring more affordable health care coverage for more New Jerseyans. The right of every New Jerseyan to a health care policy worth more than just the paper it is printed on requires us to take these steps. And as we take each step, we will continue to prove that the Affordable Care Act works. With each step, we will continue to prove that when you stand up for the Affordable Care Act, you end up with more affordable and comprehensive health care. I am proud of the work our administration is doing alongside of our partners in the legislature and our partners in the healthcare community and the carriers. And I look forward to the day when these bills will land on my desk and we can all come together again to celebrate their enactment. I hope you won't mind if we come back, Barry. And begin a new discussion on the next steps we can take to protect the health and health care of all New Jerseyans. So thank you all. It is my honor and pleasure to introduce the Commissioner of the Department of Banking and Insurance, Marlene Caride. Marlene?
Good morning, everyone.
Good morning.
Thank you, Governor, and welcome to all of our honored guests here and my colleagues, former colleagues from the Assembly, my colleagues now in the Governor's Cabinet, and of course, everyone here, and our partners, our health carriers. Thank you. Thanks to the Governor's leadership and to our partners in the legislature, 2018 was a busy and exciting year here in New Jersey for health care. We established the reinsurance program. We implemented a requirement to have health care coverage and took over plan management of the exchange in New Jersey. The results of this work was a 9.3% reduction in premium rates in the individual market this year. Also, under the direction of Governor Murphy, the state, for the first time, conducted a coordinated public awareness campaign, Get Covered New Jersey, during the open enrollment period to encourage our residents to enroll in health care coverage. Now, we look to build upon the foundation that we set last year to create and strengthen infrastructure needed to advance the ACA and to support the additional efforts to stabilize our market. We know, as the Governor has mentioned, that the ACA is under threat, and our Governor, very clearly has taken a stand to secure the protections that have been afforded the residents under federal law. As the governor stated, let's make sure that in New Jersey, the protections such as coverage for people with pre-existing conditions, coverage for young adults until the age of 26, coverage for preventive services without cost share, and many other protections afforded to us under the ACA are in our books. Together, let's take the next step and make sure our health insurance market continues to be stable so that residents can access quality, affordable care. The fact is that because we operate on the federal exchange, we are subject to the whims of the Trump administration and directly impacted by the efforts to damage and to destabilize the market. The Trump administration has slashed funding for advertising and outreach by 90%. It has slashed funding for navigators by 75%. And it has cut, as the governor mentioned, it has cut the open enrollment period from 3 months to 6 weeks. Unlike New Jersey, states that operate their own state-based exchange were able to protect themselves from the Trump administration's effort to destabilize the market. These states conducted their own outreach and advertising efforts. They funded navigators to ensure that their consumers received the critical assistance they needed to understand their options and enroll. And they determined the state's open enrollment period. States like California and New York have a 3-month open enrollment period. And following the Texas case decision on the ACA, just 1 day before the end of open enrollment, the state of Connecticut made the decision to extend their open enrollment period by 1 month. Because we rely on the federal exchange, New Jersey did not have the freedom to make a similar decision. We, as a state, should have the opportunity to respond to the needs of our residents. And in 2021, we will. We believe that we can operate a state-based exchange and provide additional benefits to the New Jersey residents with the funding that we currently send to Washington, estimated to be over $50 million for 2019. To do that, we will transfer that funding to New Jersey. We know that we could better utilize New Jersey money to protect New Jersey residents and get a better return on our investments. Funding sent to Washington to utilize the federal exchange will be better utilized here in our state, where we can establish policies that will create greater stability, access, and improvements to protect our residents. We also have the benefits of lessons learned from the states that have already have their own exchange and have operated it for years. Moving to a state-based exchange is the right next step in our work to improve access and coverage for our residents. And just as we have on other issues to improve health care access for residents, New Jersey is taking the lead. I want to take this opportunity to thank the governor for his leadership, to our legislators who have supported this position going back numerous years, to our federal delegation that continues to fight in Washington to make sure that all Americans in one of the wealthiest countries in the world have access to quality health care coverage. Thank you.
Thank you, Marlene. Great job. Great job. Thank you, Marlene. And as a Murphy, it did not go unnoticed that you're wearing a green coat in the month of March, so thank you for that. Great leadership, and thank you. We'd love to hear from some of our legislative leaders, and I'd love to ask to come on up first. As I mentioned, a guy who's a leader in the Assembly, has been right there at every step of the way on healthcare, environment, the broader agenda to get our state back on its feet, Assemblyman John McKeon.
Thank you, Governor. Thank you. You could tell the difference between the governor and the commissioner. They had like double-spaced typewritten events. I just put this together with crayon on the way in. I have to take this moment. I know Governor and First Lady, you know from your service on the board, and Governor, we all know of St. Barnabas's reputation. But to put a little bit of a view on it as I'm here, I think of my 12-year-old daughter who's 31 and about to get married, who was scalded, and the compassion that Dr. Mansour took care of her. I think of my dad, who spent, sadly, a lot of time here, and the compassion that, and the manner in which he was cared for. I think of the coffee cup, Barry, that you got me with my name on it at the emergency room for hundreds of soccer players that I brought up here through the years. So I really tell you all that, and many in this group know that, this is more than this beautiful building and the administrators you see, but just an amazing healthcare place when your family's most in need, that they're always there for you. I also want to note, sorry, Mayor Anthony, that although we stand in Livingston, the nerve center, where the power is, where all these great decisions are made, is in West Orange, New Jersey, which is right across the street. Commissioner Caridi, Marlene and I used to sit in the back of the caucus getting in trouble during the Christie years. Marlene, you may have left me, but unfortunately I'm still in the back and getting in trouble. I miss you there. You know, the Governor, you said whispered thank you to me, which I really appreciated, but, you know, lost in a lot of the statistics you heard is that 6 months ago, just about to the day, this governor, at his initiative, signed a piece of legislation that Senator Cody, Senator Vitale, my colleague Herb Conaway, Dr. Conaway was involved with, that in effect was the first in the nation that combined the individual mandate along with a reinsurance program. Now, 700,000 covered lives were about to have premiums go up by about 7%. And instead, they've gone down by 9%. So, you know, numbers are numbers, but about 6,000 is the average annual premium. So think about that, Governor. I'm going to say thank you on behalf of about 700,000 New Jerseyans who are paying $1,200 less each year for their health care because of you.
Thanks, Pat.
Thank you.
I appreciate it. Thank you.
So we're going to celebrate today the governor's executive action as far as making us the 12th in the nation to be a part of the individual exchange. And again, I won't go through all of the great things that are a part of the Affordable Care Act that we've now gotten used to, and we should have as members of this country and certainly members of the state. So with our legislative imprimatur as we go through the process, we're going to make certain that a lot of these aspects are now imbued in our laws. But just let me mention two of them and put a face to it. I know a young man that was born here and was in that tremendous NICU here at St. Barnabas. Before he could walk, before the Affordable Care Act, his lifetime cap on benefits would have been gone. That doesn't happen anymore under the Affordable Care Act, and it won't happen anymore thanks to the initiative of this legislature and this administration. I know a young lady from our district that was here at this great Jocelyn Diabetes Center. She developed diabetes, and if she turned 21 and had to get off of her parents' plan, she never would have been in a position to get on her feet financially, to continue her wonderful care that she was getting here, and get to the point to, at age 26, being on her feet, being able to go out into the market to be able to get coverage and to live a productive life as well as get quality health care. So that's what this is about. This is about individuals like that to make certain that at least the 9 million people that live here in New Jersey will be never faced with those inequities. So again, I thank you all. I look so much forward to working with my colleagues to move forward with these legislative initiatives. God bless you all.
Thank you, Ken. That was so well done. So well done. You heard, by the way, thank you for that, those, particularly the real life stories, but you also heard sprinkled through there, this is the former mayor of West Orange, for those of you watching at home. Al, I had to make sure I get that off my chest. There aren't many legislative leaders who have a medical degree. We're honored to have Dr. Elnahal in our administration as an extraordinary health commissioner. But in the legislature, when you talk about complicated stuff like this, boy, that's a perspective that you don't get every day. And it's in that respect, I want to bring up from the 7th District, a leader in the Assembly, Dr. Herb Conaway.
Thank you very much, Ben. Well, I'm here today and proud in my capacity as legislator and friend to this progressive governor that's leading our state in the right direction. We're talking today about health care security for the many in our state, parent about to have a child, the people who have children, adult parents, adult children like myself now who might need insurance as they go forward. This is about security in their lives. It's one of the most important things that people look to when they think about what their day is going to be like and what the future is going to be like. That's why we're here today. And when policy in Washington can sort of flip on the at the turn of a tweet with policies that regular people have a hard time understanding, we understand how important it is in our state to protect what is vital. Access to health care, protect what I agree with you, is a right that every American should enjoy. We're going to protect it here in the state of New Jersey, and we're going to do it by sending less money to Washington. Isn't that a good idea? Let's leave it here, helping the people here who need it. That's part of the job. And so I look forward to working with my colleagues on a bipartisan basis to deliver on the promise that New Jersey has made and has made for quite a while now. We've been leaders in a lot of these areas. We're going to continue to be leaders in this area and show these other states what they ought to be doing to push back against some of these policies that are so destructive to the security and the peace of mind that Americans ought to enjoy in their health care. Thank you, Governor, for your leadership. Thank you for all those assembled who are helping with this important effort. And good morning.
Thank you, Herb. Well said. Thanks for coming up. Are these mine? Are those? Look at how remarkably similar they look.
You got great stuff.
Yeah. Thank God it includes eye care. Couple of quick things in all seriousness. I made light, I was kidding about our kids, but one of our major policy initiatives, collection of initiatives right now, is to keep more of our young people here. Not only to go to college, but when they get out of college, to find their first jobs here. So we've thrown a lot of money at things like college affordability, developing incubator spaces, deepening the relationship between the research institutions of higher education and the real economy, as has been done in Boston and Northern California. But affordability is part of this, right? Having communities where millennials can afford to live in and also feel like are cool places to live. The notion to be able to keep young people on their parents' plan until the age of 26 is a game changer. It's on that list. It's really important. It allows young people to a degree of freedom that they otherwise may not have, either to go without health care, in the awful case, or to pay through the nose in a period of time when they're already paying through the nose to pay down their college loans. Secondly, I want to give Carol a shout out, our Commissioner of Human Services. She came to us from working in Washington and in the Obama administration and lived in this whole arena. And I want to give her a shout out because along with the whole team, she's given us the confidence that the time is right to do this. She's seen the birth of these exchanges, what's worked, what hasn't worked, the evolution, the learning curve, and I want to give you a shout out, Carol, for that. So thank you. Last but not least, batting cleanup, a member of the Hall of Fame, the Ichiro of his generation, Governor Dick Cody.
Hey, Mert, why didn't you tell me you're going to wear your earbuds?
Come on, man.
Kevin got me some for Christmas.
$95 free shipping.
By the way, last night was tough on me, I got to be honest.
Yeah.
No, it really was. FDU, my alma mater, lost. They got to the big dance. And then Seton Hall lost.
Yeah.
I'll be honest. I was about to call the emergency room here. And who would you call? My cousin, Ginger Weatherston. Ginger, stand up. Go ahead. She runs the ER. And no, I'm not going to give out her number. But I should. Barry, good to see you. Just like John, my parents both died here with grace and dignity, thanks to these people here today. And we're here. And my wife gave birth to our 2 children. And where 20 months ago, our granddaughter was born. My wife couldn't be here because she's babysitting, and she's thrilled, believe me, when I tell you that. And the other thing I want to mention is that St. Barnabas hosted the first meeting of women with postpartum depression some time ago. And then just the other day, you saw where a new drug came on the market, directed at postpartum sufferers like my wife. So, I mean, we've come a long way, and she was thrilled when she read that the other day. So, very, very happy to be here. One of the things about the governor is he's a fighter for people, regardless of your station in life. I used to have a phrase that you can't afford to get sick and you can't afford to get well. That has changed a lot since I said that. I can remember my last day as governor. I don't know if you remember this, Barry, but I was at St. Barnabas here at the hospital with Lou LaSalle, and we visited every family with a child in the hospital without any press at all. So I thought that was a great way to end that era of my life, and it was. So to all of you, John McKean, of course, my running mate, and John and Al Anthony are happy nowadays because St. Barnabas pays property taxes. I mean, that's great for a mayor, believe me. Am I right, Al? Solves a lot of budget problems. But I can remember the days of 24-hour deliveries. All right? So we've changed a lot in our society with the Health Care Act and guaranteeing people, regardless of their background, whether you live in Newark or Livingston or whatever, that you have the right to good quality health care like everybody else. And Herb, thank you for coming up. Good to see you, Commissioner, and all the other commissioners that are here and everything else. And Barry, to you and all of your staff who just do a phenomenal job, not only for our families, but everybody else. Thank you all. Great to see all the press. Great to see about health care, am I right? Yeah, okay.
Sir, just want to say one thing. A different kind of health care.
Tim, would you do me a favor?
Governor.
Take my contact out of his phone.
Governor, thank you. And I mean this when I say I wouldn't be here without you, period. A couple of questions, then we'll wrap. Please, Daniel. It's off topic. Wait a minute.
One healthcare question.
Was this about the article about a so-called whistleblower? Yes. Okay. No thoughts other than, I guess, two things that occur to me. Number one, I know the EDA has taken that very seriously under CEO Tim Sullivan, and I have enormous confidence in Tim and his team. And secondly, it's another data point that post the audit that was done by the comptroller that came out a few months ago, we stood up an independent commission to figure out what the heck was going on over those number of years, and this is another data point that convinces me that setting up that commission was a good idea. But that's beyond that. We got to figure out what's been going on over there. Again, I'm not opposed to tax incentives. They need to be a tool in our toolbox, but they can't be all the tools. We need broader. We need a broader. Businesses are like families. They make decisions to stay or come here based on a whole spectrum of factors, including health care and the quality of the health care system and its affordability and accessibility. So what we're doing today has real impact on families and on the business community as well. So I'm not opposed to tax incentives, but they've got to be part of a broader strategy, and they've got to be transparent. They have to do what they claim that they're going to do. They have to be monitored, and that's why we've put forward a new generation that we think do all the above. Beyond that, I've got no insights. Others. Brenda, you got any? No? This is a call that Dr. Elnahal would and his team would make, but I'll speak on behalf of all of us, and if I get this wrong, please dive in. I mean, we'll have no choice, maybe as early as Tuesday, to open it up dramatically. I don't want to speak for you, but we basically ungummed the medical marijuana regime almost immediately when I got here. The legislation that is being considered includes a further broadening of that in many respects. The population that are partaking of our medical marijuana regime has exploded, thanks to the steps that Sharif and his team and we all have taken. So it's gone from something like mid-teens to 42,000 people partaking of the regime. And that number, we're artificially holding that number back. We've got a wall of folks, both that group who want to have better access and deserve better access for life-saving and life-changing treatment, but also many thousands more who want to be in the system. So we're going to have no choice. I don't have a plan B written down. I don't know that Sharif's got it written down either, but we've got no choice but to open this up dramatically is the word I would use. I don't know what the numbers mean, but we can't, we owe it to these people. This is life-changing and life-saving. Please.
What does dramatically mean? Are we talking 30?
Not 6, I can tell you that much. Many multiples of 6. I'm not sure what it means, but we're going to have to take that under advisement. I hope we don't have to take that step. I hope that we get this done on Monday and then we don't have to do that. Daniel, one more. Yeah, I see that as well. I see Assemblyman Conaway and Assemblyman McKeon as well. Listen, I've spoken to each of them. There's probably nobody left in the state I haven't spoken to. I'm going to stick with my two-part answer, which is I'm not going to talk about any individual, even those who may be standing with me. And secondly, we're not there yet. We've made some good progress. I'm an optimist in life, but we're not there yet in either chamber. But we've chopped through a lot this week, working very closely with the Senate President and the Speaker. It's in all of our interests. We're all in this together. We've made progress, but we're not over the goal line yet. We continue to make progress, Daniel, but I love the fact you stay at that and keep asking. Maybe one more. I don't even want to entertain that because, as I quoted Elvis Presley yesterday, it's now or never. The only thing I've alluded to is we have no choice. Sharif and I and the team will have no choice but to dramatically open up the medical marijuana licensing regime because people's lives are at stake. Beyond that, we're playing for Monday. I want to thank again, Barry, to you and your team for hosting us so graciously and for all the great work that you do. Governor Cody, Assemblyman Dr. Herb Conway, Assemblyman John McKeon, Marlene, Carol, Sharif, First Lady, the entire team. Also, the representatives are of Senator Booker and Congressman Malinowski and Congressman Sherrill. Thank you all. This is a big day for the health care of the state, for the accessibility and affordability of persons in this state as it relates to health care, and a big day for beginning the process of controlling our own destiny in health care. Thank you all.